Great. Hi. So Kathy Senderling McDonald here. I'm joined by Christine Vergara, the public health nurse in Orange County, and Marissa Leon, a senior social worker. They're going to talk a bit about the services and approach for expectant and parenting youth and young adults in the county human services. And so take it away. Thank you. Looking forward to hearing from you.
Thank you, Kathy. As Kathy mentioned, my name is Marissa Leon. I am a senior social worker with Orange County Children and Family Services Transitional Planning Services Program. And Christine and we work together to facilitate pregnant and parenting planning conferences for any expectant or parenting youth in the county. So the pregnant and parenting planning conferences, which I call 3PC because it's such a mouthful. So the 3PCs were initiated in Orange County in 2016 after LA County. And in Orange County, we ask for all pregnant or expectant and parenting youth to be referred for a conference. And that conference is tailored to each individual parent's needs. So that starts with facilitating the meeting anywhere that that parent wants to meet at, whether it's our social service agency office or their home or a local park, any arena of their choice where they're comfortable meeting. They also get to decide who attends this meeting, who in their circle of support would they like to invite. It's not going to be a room of strangers or a room of professionals. It's who do you feel comfortable with? Who do you want to include in this meeting to walk this path with you? And we also always have a public health nurse attend the meetings. And that is just an excellent way to get them to buy in sometimes into resources and services, because sometimes they just, honestly, they're just more receptive to information or resources coming from a medical professional versus a social worker. So we have found that that's just a biggie with us, to always include a public health nurse in our meetings. And then I was going to pass it on to Christine to talk a little bit just about how those meetings look here in Orange County.
Hi, my name is Christine Vergara. I'm a public health nurse for healthcare programs for children in foster care. And we do like to assist any social worker, all social workers that need help with education for reproductive health education, parenting youth, pregnant youth, or just some education on STIs and how to prevent those, what those look like, and so on. One of the biggest tools in our toolbox is our toolkits, and they actually have examples of the different contraceptive methods. It's literally one of those where you can just touch it and feel it, and they get to see what it looks like up close, and just helps to put a picture in their mind of what is actually going to go into their bodies, or not, if they prefer not to. But one of our biggest weapons, I guess, against fear and doubt with these youth is to start meeting off with an introduction of, this is a safe space, and anything that's said here is between us, and we're not going to go around telling everybody your business, and you have rights. You have rights to privacy. You have rights to seek these services on your own without your parent, or hopefully with your significant other if they're available. But the other tool in our arsenal is, I know it sounds silly, but I've noticed a big difference in wearing scrubs. Just the simple act of wearing scrubs when we go out to meet with these youth has a better impact on their perception of me, and talking to me and disclosing their personal aspects of their life. There's actually a journal about that too, that the perception of patients is that they feel it is important that medical professionals be attired with scrubs, something that they can relate to. Okay, this is your job, and I know your role because of what you're wearing. And granted, the study was done in an ICU, but I think just generally across the board, patients have the same perception. So Marissa, go ahead. You wanted to talk about challenges, right?
Marissa, it would be great if you could talk a bit about some of the challenges with the approach. It's really great to hear about how thoughtful you have been in developing the toolkits, and even down to thinking about how your attire might make a difference in working with youth and young adults and the programs that you're serving them in. What challenges have you found in these services? It would be great to hear both what the challenges are, and if you overcome them, giving some advice for folks and thinking about how you've managed to address those challenges.
I think it's maybe an unspoken challenge right now that Christine was talking about, the contraception toolbox, is that these kids will put on this front that, oh, I know about birth control, or I know it all. But when you actually bring out that toolbox, which I love that toolbox, they actually get to touch and feel, and they start asking questions, and that curiosity of this wanting to absorb that information and know the information, you kind of see that switch flip where they're just, can I touch it? Like, oh, I don't want to touch it. Oh, okay. And how does the doctor put that in you? Does that go into my body? How will the hormones affect me? And we follow up with a sheet that kind of explains how effective each birth control is, and it's pictures, and I believe we got it from bedsider.org, which is an awesome website, and it goes through, these are the most effective, these are so effective, and then the last one, which includes the fingers crossed, is the least effective for preventing pregnancy. So I do that toolbox, I do love and can't speak enough about it. One of the other challenge that I think is ongoing is the acceptance and follow through of services and resources by these young parents. What we started doing, and I believe we have had some success with it, is that instead of informing them of Planned Parenthood services and providing them with the phone number to call to make an appointment, we actually sit there, we help them make that phone call and make that appointment. So they're learning those independent living skills, those future parenting skills that they're going to need. We help them with that. We transport them to the appointment if necessary, and we stay with them through that process. And just doing that alone, just that extra hand holding and feeling supported has made a big difference. And then accepting the resources. Scheduling appointments has also been another challenge. It can be time consuming because I do that on my end. I schedule it, I facilitate, I follow through. So the scheduling aspect of it, these are young adults and youths, and they're not always very good about returning calls or responding to calls. So once a meeting has been set up, the second part of that is getting them to follow through with meeting for that appointment. Oftentimes we were finding, it was at least 50% of the time that they were forgetting about the appointment. Oops, I forgot, or not showing up, canceling, whatever it may be. These meetings were not occurring when they were set. So now what we do is we actually call or text them the day before and just kind of do a little gentle reminder. Hi, it's Marissa. Just want to make sure you remember about tomorrow's meeting. And very few appointments now get canceled because they're like, oh, okay, thank you, I forgot. So that's one way we tackled the scheduling appointments challenge. The location and transportation, as I alluded to earlier. We initially started these meetings at our social service agency office. That is not the place where they may feel safest or open to share what they're going through or their parenting journey. So then we started doing it, and transportation was also an issue. They couldn't get to our office. So we started opening it up to, we can come to your home. Well, then we faced another set of barriers with that because sometimes their families didn't know yet that they were pregnant, or they're living with individuals that don't want people coming in and out of the house on a continuous basis because they've got social workers and therapists and CASA and mentors and whatnot. So that was a little bit of a challenge. So now we just say, we'll meet wherever you want, wherever you're comfortable, wherever you can get to. And a lot of times it's at a local park. We've done them at eateries. We'll sit out in the corner. So just wherever they're comfortable, wherever they can get to. And probably the last one that I can think of is financial literacy. That one is a biggie for me. And the challenge with that is that a lot of these expectant and parenting youths and young adults are not prepared to be self-sufficient in supporting themselves and their children. They've never been taught to budget. They've never been taught to save. They don't have bank accounts. They don't even know where to start to go about learning about financial literacy. So we are really working really hard to connect with community partners and other agencies to try to provide that that tool that's just going to help. That's something everybody needs, whether you're a parent or not a parent, more so if you are a parent. So we really are trying to create more opportunities for them to learn how to budget, save, earn money so that they can be self-sufficient in the future.
That makes so much sense. I think we could probably come back next year and do a whole breakout session on the needs around financial literacy. It's something I thought about a lot with our youth and young adults, and you know, the system and where do they really get that information. And I know there's so many struggles just with the finances in general with someone who's been in foster care, may or may not be able to kind of make it quickly through college, even though they want to, and have struggles there, and then going on to, like you said, actually being self-sufficient. And what does that mean, and how do you budget and plan? I really appreciate the way in which you've really been thoughtful in trying to overcome these challenges. I would imagine that when you have someone go with you to that Planned Parenthood conversation or to another office, it's scary for anybody. I mean, even adults don't want to talk and ask questions and sort of advocate for themselves when they don't really know somebody, when it's an awkward kind of subject for a lot of people. So I appreciate that you have done that. It sounds like that's a really workable thing that you've managed to help them overcome that shyness or fear of really being able to speak in that meeting and even get to that meeting in the first place by helping them schedule it.
And like you said, Kathy, it is intimidating, and you have two people you have never met coming to you and wanting to talk about birth control and your body and reproductive health. That can feel invasive, and that can feel so intimidating. So I mean, not that it's that big of an action, but we try to create a little gift basket when we have the meetings, when we first meet them, to kind of break the ice. And everything we have is donation based. As a county agency, everything's donation based. So there's just a little basket where if we have diapers or wipes or books, or even for the moms, like some lotion or some tissue, sometimes just whatever we get, we try to create a little basket, kind of a little break the ice, this is for you and your baby type of an action.
That's great. Christine, anything else to add on this topic or regarding the challenges or how you help make the youth feel comfortable?
Yeah, so there were two things that really stand out to me after having had a few meetings with different youth. And the first most concerning, I think, was there's just a spirit of like isolation and a lack of trust, I think, for adults, any adult sometimes, and trying to get past that is a little difficult. So I have started to incorporate the information for FERS, or the Family Urgent Response System. It's the emergency crisis line for anyone in foster youth. And then also, if they're not, or say their partner's not in foster care or anything like that, then I give them the NAMI text crisis line. And both of those are 24/7, and I make sure that they understand that they can talk to somebody. Obviously, we're going to give them resources for other individual therapy and stuff like that, but usually when you have a crisis, it's like 3 o'clock in the morning or something, it's never 9 to 5 kind of thing. So we make sure that they have that information. And then of course we like to just test the knowledge of our youth and find out where they're getting their information, because unfortunately there's so much misinformation out there. And social media is saturated with all this random topics. So we like to refer our youth to different resources here, like Moms or NFP and PACT. And these are just resources where they're organizations where they will literally lead the youth throughout their pregnancy or while they're parenting. And so they're just like literally with them, progressing as a child grows and as they grow. Also, we like to provide information that's a little bit more credible. And fortunately, these organizations like the CDC and womenshealth.gov, they have platforms. They have access through platforms like Facebook and Twitter and Instagram and Pinterest and you name it. They're expanding out, and Snapchat, believe it or not, there was some, I saw one for, so, you know, they're meeting them where they're at, and at least we can throw in some of the better information and make sure that they're getting at least a healthy dose of actual fact-based information. And that has actually helped us to better tailor our teaching to each individual, because we learn from each of the cases, right? So if they have a question about this that we've never even come across, then at least we'll know for the next time. And so we build on what we learn from them, just as they learn from us.
That's great. Thank you. I have just one more question, which is counties who are, here today or watching online, who may want to examine the services and approach that they're taking, what would be some advice that you would give to them for how they might go about that in a successful way?
Kathy, I would say definitely incorporate trainings and workshops for all staff. Make that available, make it accessible, make it mandatory if necessary. Connect with community partners. We collaborate with so many agencies, from Nurse Family Partnership to Moms to Mariners Church, food pantries. There's just such a wide array of community partners that want to help, that have the resources to help. So definitely connect with them, connect with anybody who wants to help. Engage housing providers so that we can provide housing opportunities for these young moms and dads. Just get everyone involved. Our juvenile court judges, they've gone through training, through reproductive health training, to learn about this topic and learn how to approach youths about this. They will take a youth behind closed doors at the court if the youth wants to talk to the judge, and they know how to speak to them and approach that subject with them. Our absolutely fabulous public health nurses, they've created a sexual and reproductive health care and parenting resource flyer that we provide to all dependent youth in Orange County every 6 months. So that flyer has different websites, different agencies. It's just a one-page flyer that they can access, as Christine said earlier, factual information, not hearsay information. A lot of them have cute videos, PlannedParenthood.org, StayTeen.org, Bedsider.org. I love all those different websites that they can go onto. So we really push that, especially now in this day and age. Everything is electronics, digital, going online. So I love that flyer. I guess just to sum it up, it's just getting the word out there. We're here to support the youths. We're here to educate them. We are askable adults, training your staff to be askable adults and letting the youth know, the parents know, these young adults know that there is support out there for them.
Great. Well, thank you both for joining us, Marissa and Christine. You probably can't hear the deafening applause, but everyone is applauding your work and thinking about how they can bring that back to their counties as well. Thank you for your time. We really appreciate it.
Thank you for the opportunity.
Thank you.